everyone, today we're going to talk about something called phlebitis. Now, it sounds super medical and complicated, but you know what? It's actually way more common than you might think. And figuring out what it is, well, that's the absolute first step to dealing with it.
So let me ask you this. Have you ever looked down at your arm or your leg and seen this weird, red, painful streak? Maybe it felt warm to the touch, kind of hard even? If you've ever had that and thought, what on earth is that? Then you are in exactly the right place, because we're about to put a name to those symptoms. Okay, so the fancy medical term for this is phlebitis. But let's break that down. All it really means is that a vein is inflamed. And that inflammation, it's usually kicked off by something like a small blood clot or even just some damage to the vein's wall. That's what gives you that classic red, painful line. But here's the thing. Phlebitis isn't just one single thing. Think of it more like a spectrum. On one end, it can be a pretty minor annoyance, but on the other end, it can be a full-blown medical emergency. So let's unpack the three main types you really need to be aware of. All right, this little chart breaks it down perfectly. First up, you've got superficial thrombophlebitis. It's right there in the name. Superficial meaning close to the skin, often caused by something as simple as an IV. It's less urgent. Then we have deep vein thrombosis, which everyone just calls DVT. This one is, you guessed it, deeper in the bigger veins. And yeah, this one is much more serious. And finally, there's septic thrombophlebitis. This is when a clot actually gets infected, which is really dangerous because it can lead to sepsis. The big takeaway here? Location and cause are everything. They tell you exactly how worried you need to be.
So let's zoom in on that first one, the superficial kind. People who've had this often describe it as feeling a firm, tender, almost like a little rope right under their skin. The skin over it gets red, warm, and can even be pretty itchy. This is by far the most common type, and a lot of people get it after they've had an IV in. Okay, now let's talk about DVT, because it feels completely different. You can just forget about that rope under the skin feeling. DVT is more of a deep, aching pain, a soreness that feels like it's way down in the muscle. And it usually comes with a lot of swelling. Because it's happening in those big, major veins, the whole feeling is just bigger and, frankly, a lot more concerning. And this part is so important. DVT can honestly happen to anyone, but there are certain things that really ramp up your risk. Some of them are what you'd expect, right? Like getting older or if it runs in your family. But look at the rest of this list. Sitting for a long time, long flights and desk jobs, pregnancy, certain health conditions, even having had COVID-19. It really shows you how many of us could be at risk and need to know these signs. Okay, so let's say you've noticed some of these symptoms. You're thinking, this could be something. So what happens next? Well, the next step is getting a clear diagnosis. Let's dive into how a doctor figures out what's really going on in there. You can see here there are two totally different paths for diagnosis. For that superficial kind, a doctor can often tell what it is just by looking at it. They might do a quick ultrasound just to be certain. But if they suspect DVT, it's a whole different ballgame. The process gets way more involved. We're talking blood tests that look for specific clotting markers, plus more advanced ultrasounds to literally watch the blood flowing through your veins. And the reason it's so much more thorough is simple. The risks are just so much higher. All right, so the diagnosis is in. Now what? What's the game plan? We're going to shift gears now and talk about the treatment plan, and maybe even more importantly, how to prevent this from happening again. This is all about getting you back to normal and keeping you safe down the road. When it comes to treating DVT, the process is actually really straightforward. Step 1, you get that confirmed diagnosis. Step 2, you'll almost always start on blood thinners. Their job is to stop that clot from getting any bigger and prevent any new ones from forming. Now, this isn't a one-and-done kind of thing. You'll probably be on that medication for at least 3 months. And all along the way, your doctor will be monitoring you to see how you're doing. It's a really well-established, effective plan. I love this quote from our source material because it just hits the nail on the head. Moving your body is a great way to not only treat vein inflammation and blood clot problems, but prevent them. It's so simple, right? But it's also so powerful. When we're talking about vein health, circulation is absolutely everything. So, what does that actually look like in your day-to-day life? Well, here are some super simple but really effective steps you can take. Try to avoid sitting for huge chunks of time. If you have a desk job, get up and walk around. If you're on a long flight, do some leg exercises. And if you've had surgery or been sick, start moving around as soon as your doctor says it's okay. Of course, taking your prescribed meds, not smoking, and maybe even wearing compression socks if you tend to swell, these things can make a world of difference. They're real, practical things we can all do.
Okay, as we get ready to wrap this up, I want to talk about the so what. Why does all of this matter so much? It's really important to understand what can happen if you don't take this seriously, and to really nail down the key takeaways. This is all about why listening to your body is just non-negotiable. Look, an untreated DVT is not just a sore leg. It's basically a ticking time bomb. The biggest, scariest risk is something called a pulmonary embolism. That's when a piece of that clot breaks free, travels up to your lungs, and blocks blood flow. It can be fatal. Then there's the risk of sepsis, a massive, body-wide infection that can also be deadly. And even if you get lucky and avoid those two, you could be left with something called post-thrombotic syndrome, which means chronic pain, swelling, and skin issues for the long haul. This is exactly why catching it early is everything.
So if you take away only one single thing from our chat today, please let it be this. Listen to your body. That new ache, that weird swelling that popped up out of nowhere, it's not just random. It's your body sending you a signal, and you have to listen. Don't brush it off. Acknowledging that sign is the single most important thing you can do for your health.
And I want to leave you with a final thought, a little challenge for yourself. After hearing all this, what is one small thing, just one, that you can start doing today to get your circulation going and lower your risk? Seriously, think about it. Maybe it's setting a timer to get up from your desk every hour. Maybe it's just flexing your feet while you watch TV. It's those tiny, consistent habits that truly make the biggest impact. Thanks so much for hanging out for this explainer.